Good afternoon. This is John Aaron Avalos, a BSN student at Indiana State. This is my presentation on emergency first aid and disaster preparedness, nurses trained communities. And this is for population-focused community health nursing. Population at risk: the poor, the elderly, single parents, the very young, and people with chronic diseases living in communities exposed to natural disaster. Learning objectives: know leadership and decision-making concepts. Create a vulnerability map. State how to assess the scene. Learn benefits of first aid and CPR certification. Demonstrate high-quality nursing care for medical emergencies and apply ethical principles with patient care technologies in the community. Please take a moment to click on the link below in YouTube to check your knowledge on what you know about emergency preparedness and first aid. Know leadership and decision-making concepts. During an emergency, order must be established. Rapidly analyze a complex environment. Assess where and what sort of help is required so resources can be allocated effectively. Assemble an effective multidisciplinary staff of care providers. Make informed decisions rapidly and be capable of ongoing self-assessment and adaptation to unfamiliar and rapidly changing conditions. Keep the mission and organization values in mind in the decision-making process and stay true to their values. Create short-term, adaptable, and flexible planning at the tactical level, which includes role rotating of medical personnel, flexibility in team structure, and creative solutions. Encourage operating a variety of communication channels and negotiating with local operators, international organizations, the local population, and other medical teams. Implement the HIPAA Disaster Recovery Plan, which involves following predefined assessed policies and procedures that ensure health information remains secure. In addition to covering patient care technologies, hardware, and endpoints, the plan must cover cloud-based databases, applications, and websites. Many cloud services providers offer a range of disaster recovery services to help healthcare organizations meet their compliance responsibilities. Create a vulnerability map. A vulnerability mapping provides the exact location of individuals or places at risk due to a disastrous activity that could lead to death or injury or contamination or any other destruction. Vulnerability maps are created by combining information about different types of risks. What factors are considered? Socioeconomic, household composition, disability, minority status, language, housing, transportation, and location. How is the map used? Estimate the number of needed supplies like food, water, medicine, and bedding. Help decide how many emergency personnel are required to assist people. Identify areas in need of emergency shelters. Plan the best way to evacuate people, accounting for those who have special needs, such as people without vehicles, the elderly, or people who do not understand English well. Identify communities that will need continued support to recover following an emergency or natural disaster. Assessing the scene. Assess the situation before and when your group arrives to the scene of the emergency. Determine if there is ongoing danger to the people around you or others in the area. Do not place yourselves in danger. If necessary, move to a safe area. If you can, help others get to a safe place. Determine the severity of the event. What types of damage or injuries have occurred? What types of responders and support are present? Stay informed and share as much information as possible with your group. Identify what information can you share per HIPAA guidelines and what still remains unknown. Find out what additional resources are available for this specific event. This includes updated information about the incident, shelter, food, water, rescuer services, help to reunite families, mental health, transportation, and other needed supplies. Benefits of first aid certification. It saves lives, relieves pain, relays communication to emergency services, increases safety, and emergency preparedness. Benefits of CPR certification. Saves lives, employability, safer home and community, teaches others, and emergency preparedness. Demonstrate high-quality nursing care for medical emergencies. If someone is not breathing, administer CPR. Call 911, lay the person on the back, tilt head slightly, give 100 chest compressions per minute, and continue until EMS arrives. Bleeding. You should wear gloves, stop the flow of blood, cover the wound, apply pressure, any amputated parts place on ice. Shock. Lay the person on their back, cover, and raise their feet. Heart attack. Call 911. Make the person comfortable. Chew aspirin or take nitro. Loosen tight clothing. Check for medication. Do not give stimulants and begin CPR if necessary. Choking. Determine choking by asking the person to speak or cough. Deliver 5 back blows with the heel of the hand. From behind the person, make a fist and place it above the navel. Grab the fist with your other hand and push it inward and upward at the same time. Perform 5 abdominal thrusts until the object is expelled. Electric shock. Do not touch them. Turn the power off. Call 911, remove the person from the area, and check for breathing. Heat exhaustion. Move them to a cool place. Lay the person down. Elevate their feet. Give fluids and apply cool compresses. Hypothermia. Remove any wet clothing as needed and help the patient dry off. Make sure to warm their trunk first and not his hands or feet. Doing that can cause shock. Avoid immersing the patient in warm water as rapid warming can produce heart arrhythmia. If the patient is not breathing, start performing CPR immediately while waiting for emergency help to arrive. Spinal injury. Never move a person with a spinal injury unless they are in further danger. If the victim is wearing a helmet, do not remove it. Place towels on the side of the neck to prevent movement. If the person is choking or coughing up blood, work together to keep the victim's head aligned with the neck and the back while rolling him onto his side. Applying ethical principles with patient care technologies in the community. Number 1, secure technologies containing the patient information. Keep the screens locked when not in use. Hold all conversations containing patient information in a secure location. Do not leave any technology unattended. Ethical decisions. Triaging. Prioritization of which patients to evacuate first prior to an impending disaster. Consideration must also be given to ensuring that proper palliative care is given to patients who will not survive the disaster but will live for a while. Nurses need to question if their plans address patients to care for first, evacuate first, and provide resources. Allocation of resources. Nurses need to know what resources are available in a crisis and who will receive them if there is a shortage. Examples of resources that may be scarce in a long-term care during a crisis include staff, concentrators, oxygen tanks, medications, antivirals, and IV fluids, personal protective equipment, food, water, utilities, and transportation. Crisis standards of care. Nurses may provide care outside of their professional practice. The duty to do no harm may be in conflict with staff's ability to care for large numbers of patients. Altered standards of care may include having additional staff and time trained to provide personal care to patients. Depending on the scope of the emergency, organizations will need to respond to potential staff concerns for their own loved ones if there is a regional disaster, and basic health and medical needs of staff. Here are some additional resources on emergency first aid and emergency preparedness. Please take a moment to take a post test by clicking the link on YouTube to see what you have gained about your knowledge. Thank you very much for listening to my presentation. Have a very nice day.